Founder of the Deuk Spine Institute and surgeon. We're going to be doing a Deuk laser disc repair on a patient who has 4 herniated discs, L2-3, L3-4, L4-5, and L5-S1. These are in his back. He's got back pain in the lower back, but he's also got pinched nerves from herniated discs and spinal stenosis. So we're going to be unpinching his nerves, preventing the damage from getting worse to the nerves, and we're going to be treating his back pain. So you can see the MRI scan. It has 4 herniated discs, and the bottom disc is actually also not just herniated but degenerated. It's been there for a long time. We're going to get started, okay? Yeah. You're going to feel a little stick and burn. That's just the numbing medicine going in. Okay? If you feel pain, just say ouch. Don't try to move. If you try to move, you might move yourself off the bed. We don't want that. All right, so we're on the left side. Our patient has more weakness on the left. As a matter of fact, sorry about that. That's just the numbing medicine going in. I apologize. When I checked our patient yesterday in clinic, I asked him, do you have any weakness? And he said, no, I don't have any drop foot. But when I examined him, he indeed did. So it bears home an important point in the examination of the patient. A lot of times patients don't realize how bad their condition is because pinched nerves usually happen slowly. Lay still. Pinched nerves happen slowly, and they're insidious. Insidious just means they slowly cause damage and suffering and pain and damage to the nerves with weakness, numbness. But it's not something that happens suddenly so you're aware of it. It happens slowly so you may not be consciously aware of it. That's why we do the physical exam as part of our workup. All right, I think your table could be dropped just about half an inch.
Thank you.
Doctor, if you can drop the table half an inch. We got too much space. Take a shot, let's see where we are. That's too much. That's more like a full inch. That's probably good. That's good enough for government work. All right, you can see the needle is heading towards the L5-S1 disc. We need to clean that up a little bit. I think we're off on just a wag by a degree. If you can make that a little better. So what you're seeing here, Henry, you're showing the X-ray lateral view.
Yes.
Is the bony spine. And Jordan, once you get it, oh, that's better. That's definitely better. But unfortunately, it's at the bottom of the field. So, yeah, I might be okay. Well, once you move it, we're going to have to re-wag it. That's the problem. But go ahead, get that L5-S1 centered up a little bit better. That's all right. So let's see, I think that's pretty good on the wag. And I'm looking at the pedicles, show the audience the pedicle, the vertebral body. There's the pedicle, that's, no, a little further back. That's the pedicle, just go left to right. That's the pedicle right there. Vertebral body is that rectangle up front. Show them the disc at L5-S1, good. And we're gonna aim for the back of the disc. That's where the herniation and tear is that's causing the back pain. All right, let's give a little num-num. Num-num is numbing medicine, but if you don't give num-num, you could get some sounds you don't want to hear. Now for the lower back, we perform everything with the patient awake, and then they put them to sleep with what's called conscious sedation, where they're still conscious but they're sedated. Shot. I'm touching the facets at L5-S1. So I'm going to redirect a little bit more lateral. Shot. Now our patient travels to us, I think, from South Florida, right? Pardon me? Oh, North Florida. I apologize. North Florida. Is he reliable? Shot? All right, we need to clean up 5-1 a little bit. Is your fluoro all the way down?
Yes, sir.
Is he doing good? The pedicle of 5 looks really good. No, that's worse. Why did you do that? That's a lot worse. Go back to where you were. And go ahead and give me an AP. AP is a different view. We're using our X-ray machine called the fluoroscope to navigate the needle and the instruments that I'm using to do the surgery right to the back of the spine where there's a hole. And that's, the needle tip is in that hole right there. That's called the neural foramen. We're going to get into the L5-S1 disc through the neural foramen. So we're not taking any of the bones out of the spine, none of the ligaments out of the spine. Everybody that does open surgery, which is 99.9% of spine surgeons, they remove bones and ligaments from your spine in order to get to the disc. We're going to fix this disc without removing any bones and ligaments. So, shot. I think I'm a little lower than I want to be. I don't know if I'm in, if I can get in or not from here. I think I have to go a little higher. Shot. Shot. And it keeps sending me south. Shot. Shot. Yeah. I knew he's collapsed at 5-1, right? Are you comfy? Shot. So 5-1 is pretty darn collapsed. Is there any way to get the end plate of S1 lined up a little better? It's going to be a wag thing. I just want to see that a little better. So what I was trying to say earlier is you really need to get your X-ray pictures perfect before you try to navigate. Because if you don't, you're going to be navigating to the wrong place. Yeah. Huh? What is it, Jordan?
A little bit more, see if that helps.
Yeah. I'm going to have to go a little bit higher. Shot. See that 5-1 disc space? I just really want to open it up. I know it's collapsed, so we got to do the best we can, but how's he doing? Shot?
Great. A little sticky, but he's okay.
Shot? All right. So 5-1 we may end up having to just access later. Better. See, reliable here? Shot? Shot. It's moving.
What? He's not feeling anything.
Yeah. Shot. And you're pulsing, right? I think we're off on the picture. Can you wag until you get a better S1 end plate? That's worse.
How you doing, buddy? Keep your head down for me. Good.
You're doing great. Just lay still.
Just try to stay still.
That's better. Now look at that. That looks like we're right at the disc. And we can look right through the end plate there. I think we're right at the disc. It's just so collapsed from arthritis, spondylosis, you know, degeneration of that disc. So, no, he's had the pain longer than that. Basically, his 5-1 disc is very degenerated. It's what most people call bone on bone. We're still going to get rid of the pain there. Let's get a quick AP. Because people think, oh, I got bone on bone, I can't do the Deuk laser disc repair laser surgery, but yes, you can. Because it's not the bone on bone that's the problem. It's the inflammation in the annular tear. That's what causes pain. That's really good, actually. I'm happy with that. Let's just leave that there. All right, go back to a lateral. Let's go up to L4-5. I'm going to make an incision. Our incision is 7 millimeters. We're going to do the whole endoscopic surgery through probably one, but actually maybe two incisions. It's really hard to get 4 discs with one incision. I would say we can probably get 2 or 3 with one incision, and then we'll have to do a second incision for the L2-3. L2-3 is the top disc. No, we got to do better than this, guys. Drop the fluoro to the ground if you haven't already, and then bring the table up 1/2 inch. That's it. Shot. That's good. You got to get that 4-5 lined up. Need better than that. So we are going after the L4-5 disc next. Again, we're going transforaminal endoscopic. That's not horrible, but it's not great either. If you can improve that WAG a little bit, I think your orbit's fine. You can see the patient has some facet joint disease as well. I don't know, see what you can do to make it better. I think we're close. Shot. Maybe you got too much in the back with the collimator. You can close that down a little bit. Shot. Can feel the facet joint. That's pretty good. Clean it up a little bit. Shot. All right. So I'm aiming for the back of the L4-5 disc. Shot. Shot. That's it. Why does transforaminal work, Shot? This approach works because all the problems that discs cause for patients are in the back. That's why. They're not in the front, they're not in the side. They're literally in the back of the disc. So if you want to fix whatever's ailing the patient with a disc problem, you got to go to the back of the disc, the back corner, either right or left or both right and left in some cases. Is he okay? Shot? Yeah, I'm just feeling the bone spurs of the facet. Are you comfy? Shot, I can feel the herniation right there.
He's good.
All right. And L4-5, a big tear. I could put that in so easily. So, any update on the IV contrast situation with the quote-unquote national shortage? The same song and dance? Same nonsense? Uh-huh. All right. Well, any questions from our audience so far, Henry?
Yes, we have a question from Mitchell on YouTube.
Hello, Mitchell on YouTube. Welcome to the live stream.
And he asked, can you get put to sleep for something like this?
The patient, so Mitchell's saying, can you get put to sleep for something like this? This patient is going to go to sleep. Well, you're just watching the very beginning of the surgery. And you may have heard of awake surgeries. This is an example of a hybrid. Awake in the beginning, asleep later on. Don't move, lay still.
You're doing great.
And so this patient will be put to sleep and he won't remember anything about the surgery. We're going to give him some happy medicine soon. But right now in the beginning, because we're navigating right where the nerve roots are, we want to make sure he's awake so he can tell me if I'm a little too close to one of those nerve roots. That's the best detector for the surgeon being too close in his approach to the nerve root, because the nerve root's coming out right where we're going in. So we need someone to help us identify if we're too close, and that's what the patient does. That's why they're awake. We don't keep them awake to torture them. We keep them awake because we need their help, their information, their sensors. But it's a great question. Shot? Yeah, trust me, I would rather this patient be asleep. Shot? If this patient was asleep, we wouldn't have any issues with movement or complaining. So from a surgeon standpoint, it's always easier to do, just lay still, it's always easier to do surgery when the patient's asleep. But from a safety standpoint, having the patient awake is better. All right, so I've just passed through the tear in the back of the disc on the left side, the herniation and tear. You can actually see the herniation on the x-ray. Can you show them the herniation there?
Yep.
Right there. You see it? Jordan's pointing to it. That's the L3-4 herniation right there. Okay? We just passed through it and through the tear, and now we're in the disc. So the question is, will I be able to get L2-3, or should I make a separate incision? I'm going to make a separate incision. And the reason is, my incisions for L2-3, hey, lay still. Lay still.
You're doing great, my friend.
Everything's good. The incision for L,
Where are you feeling it? In your
probably the back.
back or your leg?
Yeah. I'm nowhere near the nerve root, so. What was I saying? I think I answered the question, that first question, but because we are going to put the patient to sleep, shot. But we need their help in the beginning, basically, and to keep the surgery safe. There's two things that I need from them before they go to sleep. Number one, I want to make sure I'm not too close to the nerves that are coming out of those holes. And number two, I want to verify that this is indeed a painful disc. Because after all, I'm curing their back pain with our procedures. We want to make sure that that disc is a cause of their back pain. Yeah, I know, that's your facet. Shot. He's not happy about me being close to the facet. Shot. So for those diehard fans of mine, I'm going to give you a little pearl about why, Shot, L2-3, the approach is a little bit more medial. It is because the kidney is up here. And if you start too lateral, you will hit the kidney. And that's bad. I don't talk about these things much because honestly, the audience that watches these surgeries is usually, we do have surgeons that watch for sure around the world. We get comments all the time. I had a surgeon the other day send me basically a thank you Facebook messenger saying, hey, I'm doing, transforaminal endoscopic surgery. I've watched your videos for a long time and thank you for helping me, and I'm trying to use your technique. So I know we have surgeons that watch Shot, and they're trying to take what I teach and apply it in their practice with their patients around the world, which is great. But that said, that's why L2-3 I go a little more medial at my entry point, because I'm going to go basically avoid the kidney. Okay, so here we are. We've got 3 through 1 and 1 through 1. Yeah, all right. So this patient, once again, has 4 discs that are damaged. He has the L5-S1 disc. And he's got an L4-5 that's herniated, an L3-4, and an L2-3. All right, so L5-S1, L4-5. Is he awake? L3-4, L2-3. And he's got herniations on the sides of these, back sides of these discs at L4-5, L3-4, L2-3, and L5-S1. Plus L5-S1 is pretty collapsed and degenerated. Now, I don't have my needle all the way in L5-S1 because it's so collapsed, but I have it right at the entrance of the disc. So we're not going to do a discogram there. But we are going to do the other 3 because we're inside. Are you awake? Are you comfy? Good. Let's see. I don't know which one this is, but we'll figure it out soon with the x-ray.
No.
Huh?
No. You can't.
Oh, you're right.
So I think this is
That's got to be 3-4.
correct.
Yeah. Are you comfy? Any pain? No pain. I didn't hear him. He said no pain though. Are you comfy?
Where's your pain location?
No, don't point.
Don't point. Okay.
All right. How bad is that on a scale of 1 to 10?
5.
No higher than a 5. It didn't go higher than a 5?
3-4. Yeah.
All right. Is that where you typically get back pain? What? Is that where you get your back pain normally?
Where that pain was? He said yes.
Yes, all right. Anyway, that was a lot more of a response than a 5. 5 over 10. Concordant. But he says the maximum was a 5, so that's what we'll put. So we just tested the L3-4 disc with a discogram called an evocative discogram to test to confirm if the disc is the cause of the pain. There's no other test in the world that tells you except for this test. And it's very reliable. You comfy? All right. How bad is that on a scale of 1 to 10? I can't hear him.
I'm sorry.
What's the highest it went?
He said a 3.
All right, 3 over 10. Is that where you get back pain typically? Yeah, one of the places.
Yes.
Yeah, so it's concordant. All right. Well, he's a pretty stoic guy.
I don't have any anesthesia. There's no anesthesia.
No, but he's jumping. Yeah, I mean, that's, 3 is you're cutting your nail and you accidentally cut a piece of your finger. But that was like a serious response. But anyway, he labels it as a 3, so that's what we're going to put. But that's where he gets his back pain typically. He's stoic. Stoic means, and stoic is known in medicine as a patient who, has pain, but they just minimize the pain for whatever reason. They're tough, or maybe it doesn't bother them that much. And that's where anxiety really comes in. So he's not an anxious person. He's a very sedated kind of person. He doesn't let pain get him all worked up. But
He had a colonoscopy without any anesthesia.
really, colonoscopy without anesthesia, that's amazing. Yeah. Yeah, I don't do my colonoscopies without anesthesia. Yeah. Oh, I know. It's uncomfortable. All right, you comfy? How bad is that on a scale of 1 to 10? 5. Is that where you get back pain? Yeah, it's one of the places. All right. Well, I got great news for you. We're going to put you to sleep. When you wake up, we'll be done with your surgery. So for those of you watching, we've done the parts of the surgery that are necessary for the patient to be awake and participating. And now we're going to put the patient to sleep. So. At this point, I'm putting my guide wire in at 4-5, and I'm going to remove the spinal needle. We've already made an incision at 7 millimeters. So I'm going to basically create a guide or a path using this, we call it a wire. It's not like an electrical wire, it's a kind of a stiff stainless steel wire. And now we've got our path from outside here, the operating room where all of our instruments are. We've got a clear path down to the annular tear and the disc herniation. And the guide wire is going to take us there. So I can run this down the guide wire and I know it's going to end up right where I want it, but also it's going to not go anywhere along the way and get sidetracked, right? So it's guiding the tip of this the entire path from the skin all the way down to the herniation. That's what makes this surgery so amazing. Now this approach, called the transforaminal approach, I did not develop this. This was done by Dr. Parvis Cambin at Pittsburgh. He's an orthopedic spine surgeon from back in the 80s. And he developed this path from the side. And he taught it to a couple of spine surgeons. This is getting flared a little bit at the end.
I can check that.
So I think we need to make sure we have a few more we buy, and
Yeah, we have that.
we can keep using it for now, but at some point we may end up having to take it out of use.
No problem.
But go ahead and make sure we buy a few more.
Yes, sir.
big tear there. I can feel it going right into the disc very easily. And no surprise, because you could see the tear and herniation on the MRI. But this disc is definitely one of his painful discs. All right, we're in with the dilator. Next is going to be this tube. And this tube looks like a straw made out of metal. This is what we're doing the whole surgery through. That's why the Deuk laser disc repair, what you're watching today done at Deuk Spine Institute, is literally the least invasive. Least invasive, smallest incision, least amount of trauma and damage, no bleeding, no scar tissue. I mean, this is your bleeding right here. It's almost nothing. If we were doing a back fusion on him, which would work as well, I would have an incision on his back from here to here. It'd be a foot long. There would be 400 milliliters of blood loss. Most surgeons would lose 2 liters, 2,000. But I do them very well, and we lose about 400 mils rather than 2,000. But this surgery, we're going to lose 4 mils, which is very small amount of blood. So we're going to use the X-ray once again to guide us, placing the tube into the disc space, just starting to enter the disc through the tear. Now, people ask me all the time, does this do damage? Absolutely not. The only damage we've done is this cut right here, 7 millimeters in the skin. But because we're spreading the muscle fibers apart, and because we're not damaging the muscles, and we're entering the disc right where the herniation is, so we're actually pushing the herniation back into the disc. And that's safer to take out pieces of herniation from inside the disc and the tear than it is taking them out of the neuroforamen. Yeah, it's great. Yeah, we're good. We're right there. We're inside the tear.
Can you help me with the hand, please? Yeah. The right take there, please.
You got to start thinking about the procedure, like all the steps. So I'm just talking to one of my assistants here. You know, surgeries are literally a sequence of steps, just like if you're cooking in the kitchen, a meal, right? You have steps. You grab the carrots out of the ice box. You peel the carrots, and then you start to dice the carrots or cut them whatever way you want for your meal. And those are steps. The removal, the cleaning, the peeling, the dicing, they happen in a certain sequence or order. Surgery is no different. All surgeries, if they're done properly by the surgeon, should occur in steps. You know, clearly identified and reproducible steps.
Thank you.
So these steps we replicate, reproduce, recreate every single time we do the surgery. And that's the nice thing, is that if you follow the steps, you get the same results every time. And those are the best results possible. So, all right. So the laser fiber is at 12 o'clock. It's the fiber itself that transmits the energy is clear. It's a glass fiber. It's a long, long, long glass fiber. How long is it? 6 feet?
This one is actually 9 feet.
9 feet.
Yeah.
So 9-foot long piece of glass, like a little tube of glass. Not a tube, but I don't know what you call it, a fiber, I guess, because it's not hollow like a tube. Oh, these herniations are driving me crazy. Having to stop and go in and grab them. Usually they float out, but they're misbehaving today, making my life more difficult. All right. Now I can improve my focus just a little bit here. There we go. That's better. You can see the inflammatory tissue right there. It's got oh, come on. It's got a pink color. Okay? It's pink because it's called granulation tissue. It's vascular. Has small capillaries, lots of them, with very thin walls, so you can see the red blood cells in the walls of the capillaries. That gives it a pink hue or pink color. The blue stuff is the stained nucleus pulposus that's herniated, degenerated. So to degenerate, it has to herniate mostly. It doesn't always have to herniate, but the blue dye will stain degenerated nucleus pulposus. And most of that stuff is herniated as fragments. Some of it's still in the disc because remember what I said before, that inflammation causes the nucleus to degenerate. What degeneration is dry up, desiccate, and collapse, so lose volume. It loses water. That's why it dries up. And then also it turns acidic. So it binds to this dye. So you know where the degenerated nucleus is because it turns blue. If it's not degenerated, it stays white. We want as much white disc to stay here as possible. That's the white nucleus, not the white annulus. Different parts. All right, there's a piece of herniation. Let me see if I can grab it out. It's just sitting there.
We have a couple of questions from YouTube.
Yeah, whenever you have questions, just tell me.
Nope.
Before we take the questions, though, let's just run a quick video showing our audience why does a herniated disc cause back pain? What's the mechanism? How does that happen? Because we created a nice video for educational purposes, and we're the first place in the world to discover why does a herniated disc cause back pain. And this video will show you why. You won't hear this anywhere else because we're the ones who figured it out. All right, go ahead.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. I hope you enjoyed our animation. We created that at Deuk Spine Institute a few years ago to teach people how does a herniated disc cause back pain. Because a lot of doctors don't even know how herniated disc cause back pain. They won't be able to tell you. But we figured it out through studying the pain and doing surgery on the discs and basically a lot of research and analysis of our results and outcomes, and seeing that when we debride the tear and get rid of the inflammation, that takes the pain away. Also seeing the inflammation in the tear visually with the endoscope. So you really have to be an endoscopic surgeon to be able to see inflammation in an annular tear. You could do it in a cadaver if you take the disc out on a dead person, but by then all the inflammatory mediators are already gone. So the most reliable way to figure this stuff out is through surgery. Just the kind of surgery we do, the Deuk laser disc repair. That's given us a very unique perspective into what causes back pain and neck pain. And that's what we treat with the Deuk laser disc repair procedure, is back pain, neck pain, thoracic pain, and pinched nerves, spinal stenosis. All right, we'll take our first question.
All right, the first question comes from Brandy B on YouTube.
Hi, Brandy, on YouTube. Welcome to our live stream at Deuk Spine Institute.
And she asked, does the first part of this surgery feel anything like spine injections for pain?
Okay, so does the first part of the surgery feel anything like spine injections for pain? I would say yes, it's pretty darn close because it's the same kind of needle used. So yes, I think it does feel for the patient like the spine injection. Now, I will qualify that by saying there's, and I make this point all the time, Brandy, is that not every pain management doctor is equal. And many of them, you know, for some reason their patients are really uncomfortable during spine injections. And there are some that do a much better job of controlling pain and discomfort during the injection. We do a very good job. We actually have an anesthesiologist here who makes the patient comfortable. I don't think you can see him in the video, but he's at the head of the table. And Dr. Berndes is monitoring the patient's vitals, making sure their heart's working properly, the lungs are working, they're breathing, and that they're not in pain, you know, very minimal pain. Of course, I do a little bit of injecting. That's a herniation right there. I do a little bit of injecting as well along the way to ease the pain. So, but I think that's pretty good point that you're making. I would agree with it. For the most part, it's true. Next question.
Next question comes from Joyrider on YouTube. And they asked, hello doc, how much does a procedure cost to repair a single disc?
Great question. How much does the procedure cost to repair a single disc? That's a tough question to answer, but I'll give you an honest answer. First of all, it depends if that single disc is in the lower back or in the neck or the thoracic. So we repair discs that are thoracic, cervical, and lumbar. And they're all different costs because the expenses are higher for cervical and thoracic, so they're more expensive than lumbar. And then it also depends on what the insurance pays. It depends on, you know, what kind of insurance you have and how much they're going to cover. So the patient's responsibility depends on really the insurance payment and the disc and how many discs and how many sides. So it just really depends on multiple variables. But if you know somebody that's interested, the best thing to do is to go ahead and submit the MRI scan at mri.deukspine.com. MRI, go ahead and put the link in, Henry. It's a free MRI review, and if that person's a candidate and they have a single disc herniation, we can have the surgery center give pricing on what it would cost. I don't do the pricing myself, so that's why I can't tell you, but I just know that the price depends on multiple factors, including the location of the disc and the insurance. So some insurances won't cover the procedure, others will.
We have another question on YouTube.
Yes.
This comes from Shayla.
Uh-huh.
And I believe this is a follow-up question from Brandy's question.
Sure.
They asked, can you do the same or similar treatment if the nerve is pinched by the muscle?
Can I do the same or similar treatment if the nerve is pinched by a muscle?
Yep.
So I'll be honest with you, and I appreciate your question, but the reality is nerves don't get pinched by muscles. That doesn't happen. So if somebody told you the nerve is pinched by a muscle, that's not true. Again, the best thing to do is to take the MRI and send it to Deuk Spine Institute. I'll personally review it and tell you where the nerve is being pinched. There is one case of ulnar nerve entrapment at the elbow where the ulnar nerve will be pinched by the fascia of a muscle called the flexor carpi ulnaris. But that's not a pinched nerve in the neck, that's a pinched nerve in the elbow. And it's very different than the disc problem. So I don't know if that's what you have, but that's the laser surgery is not done for that. This is for discs. So just to reiterate, I've never seen a nerve pinched by a muscle except for peripheral neuropathy, ulnar nerve And so whatever that is, it's either not correct or it's an extremely rare case, which I've never heard of. But listen, I only say that because I know there's so much misinformation out there about pinched nerves and neck pain and back pain. So the best thing to do is send your MRI to us, let us look at it, figure out what's wrong, and show you what's wrong, and then discuss treatment options with you. That's what we do. We do it for free. We don't charge. So there's no cost to you. We do it basically to help people get the truth about their condition. All right? All right, we're pretty much done here. Might be able to get a little bit more right there. But otherwise, we're done at L4-5. And we're going to move on to what, Luis? L3-4. So we're going to do L3-4 next. Okay, laser off. Scope off. We're going to use a little antiseptic just to keep everything clean. Yep, thanks. Just give it to me. I got it. Thank you. So, all right. Any more questions from our audience?
No current questions.
Great. Let's go ahead and run the video showing what is the Deuk laser disc repair for the lower back. How does it work?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com. Welcome
back. Back to the operating room here at Deuk Spine Institute. We're just finished the L4-5 disc repair. Now we're going to do the L3-4 shot. So I've got my guide wire in. Once again, I'm going to take the spinal needle out. We don't need it anymore. I'm going to bring this dilator once more to spread the muscles and fascia down to the disc. So again, this doesn't cause any damage at all. It literally just spreads things. Shot. And I'm going to do a little numbing medicine, right? So I'm going to give him a little more numbing medicine to keep him comfortable. I'm using a port in the dilator to do that. No, not yet. Shot. All right, you can see the L5-S1 disc at the bottom, L4-5 above it. Now we're at L3-4. Just about there. I'm going to give my anesthesiologist a chance because this is the most stimulating part of the surgery for the patient because we're going right through that painful part of the disc. So he's not going to like it, but that's the herniation right there. Tell me when. Proceed. looking good. Well, let me just feel it. Yeah, go ahead. Uh-huh.
Awesome. Thank you very much.
Now we're inside the L3-4 disc. We went right through that herniation and tear. So there's no damage to any of the good part of the disc. We literally are going through the war zone, which is in the posterior annular tear. This technique of entering the disc was taught to me by Dr. Anthony Young. He was a very, very busy endoscopic spine surgeon in Phoenix. And I went to Phoenix many times to train with him 16, 17 years ago. And he taught me this intradiscal approach, which is starting inside the disc. He's now retired, but he has over 10,000 of these surgeries he's done. He doesn't use the laser. He just uses grabbers and a radio frequency probe, which I don't use because I don't think it's as good as the laser. But so I modified what I learned from him. And honestly, I'm probably the most laser using surgeon for spine procedures in the United States and possibly even the world. A lot of endoscopic surgeons don't use laser. It's expensive, but it's amazing and costs a lot of extra money, but it's worth it. It does an amazing job. Let me know when you guys are ready. We have any questions?
No current questions.
I need to see what I'm doing here. Okay, now we are inside L3-4. Now look at that view. That's beautiful. First thing you can see is a faint blue at 12 o'clock. That is the annular tear with the herniation. To the right over there at 1, 2, 3 is pink tissue. That is exactly the inflammatory tissue I was telling you about within the annular tear. It's always there. Sometimes you don't see it as well, but it's always there. Now, inflammatory tissue is normally microscopic, so when you actually see it, that means there's a lot. Oh. And this is a war zone inside the back of your disc. The war zone. All right? What war is happening? What war is happening is this. This blue stuff, the herniation of the nucleus, shouldn't be there. And by being there, it's causing an inflammatory reaction in the annulus. That was discovered at Deuk Spine Institute. We published it 10 years ago. We discovered it 16 years ago. And we're the first in the world to talk about how the painful annular tear is the cause of back pain, neck pain, thoracic pain, just wherever the herniation actually is. And we're the first to treat it. And we're the first in the world to publish on a treatment for painful annular tear called an annular debridement. That is the main part of the Deuk laser disc repair surgery. We're not performing so much of a decompressive discectomy, we're performing an annular debridement and discectomy. The truth is that out of every 10 disc herniations people have, maybe 1 or 2 of them pinch the nerves and compress the nerve root, and they need decompression. But the other 8 out of 10 have no nerve root compression. They just irritate the nerve root through a chemical irritation. So you don't need to do a decompression surgery. You need to do a removal of the inflammatory cause of inflammation. And so that's not the same as a decompression. To decompress something, you're taking the pressure off of it. But this isn't a pressure issue 8 out of 10 times, not 80% of the time. It's a chemical irritation problem, right? So, for example, is the difference between something squeezing your arm versus putting bleach on your arm. The bleach doesn't compress your arm, it just burns it, burns the skin. So it's chemical. A chemical, we call it irritation. And that's what most spine surgeons don't understand. Virtually all spine surgeons and spine doctors don't understand the chemical irritation associated with a herniated disc. There are some doctors in the world that understand it. Very few of us. There's more research being done on it now. But we discovered it 16 years ago at Deuk Spine, and we've been treating it for 16 years. ahead of the rest of the world. By the way, we had brownies yesterday from one of our patients who had the first plasma rhizotomy done, just plasma rhizotomy. She had facet joint pain in her lower back. She had horrible back pain for many years. She had pain coming from herniated discs and from the facet joint. So she had two sources of pain. So we did her disc surgery and she did much better, but she still had facet joint pain. So we did a radiofrequency ablation on her and the pain went away, but it only lasted a few weeks. So because the RFA is a mild, weak procedure, we decided to kick it up a notch, and we did the plasma rhizotomy, which is a much more powerful. It's only done at Deuk Spine Institute. She had it done, and she came back a week later, yesterday, and she was beaming with happiness. Her pain was 100% gone. We did a testimonial, right, Henry?
Yes, we did.
And her testimonial will be released by the end of this week. You'll see just how happy she is. She actually is very high up in the space program as an administrator, an engineer. So now she can go back to doing her work, and maybe the space program will accelerate. Because I know NASA's been having problems. It's in the news. They're way over budget by billions of dollars. So maybe now the program will be under better control, right? They have a happy employee. We get a lot of our patients are from NASA, from SpaceX, Blue Origin, tech firms, defense contracting firms. Yeah, because we are in basically the aerospace corridor of the United States here in Spaceport, Florida. So we have a lot of really very educated people that come to Deuk Spine. It's quite wonderful. We love our patients and appreciate all they do for our country, and we want to make them better. So she actually baked brownies for the whole team, 2 trays. Yeah, they were really good. They were like perfect. A little crunchy on the outside and kind of gooey in the middle with nuts.
Did they have pecans?
Huh?
Pecans?
Yeah, they had pecans on the top, I think.
And the inside too.
Yeah, they were so good.
Oh.
I even had one. I'm not supposed to eat those kind of things. I couldn't resist.
I had like 4.
Anyway, it's always nice to have patients who appreciate what we do as doctors.
We have a question from Facebook.
Yeah, sure, I'll take it.
This comes from Gail,
Hello, Gail on Facebook. Welcome to our broadcast.
and they
Go ahead.
and they asked, Doctor, where does all the debris go, or is it being sucked out?
Where does all the debris go? That's a great question. So watch what happens when I hit the laser on. Notice how the liquid here gets foggy. It gets a little cloudy. That's the debris. The laser blasts it into little pieces. It just douses it with tremendous amount of energy. But look at all that right there. You see how it gets cloudy? That cloudiness is the debris. So you're just not seeing it as big pieces. You're seeing it as tiny pieces because it breaks it up. And that just floats out. Because we have irrigation going in. So it just floats out to the top. Great question. See as it gets cloudy there? That's all debris. This is the herniation, by the way, in case you're wondering. All this stuff here. It's all scarred up. Look at that golden color. That's calcium. So when things in your body get damaged and scarred, they also get calcium on top of the scar and inside the scar. And that's what we're seeing right there. Bits and pieces of scar tissue with calcium. The other stuff is scar tissue right here as well. So the reason why there's so much scar tissue is there's chronic inflammation. In other words, the damage has been going on for years and years and years in this man's disc. This is the tear right here. This is the debridement. All of what I'm doing is the annular debridement. And that's why the Deuk laser disc repair is so different. We're the only ones in the world that do it. We're the pioneers, the first ones. But this is how you cure back pain. And I've been trying to teach people about it we've been broadcasting for 10 years now almost at Deuk Spine, these surgeries. So if you go back on YouTube, you can see 10 years worth of these surgeries. You can find surgeries and testimonials from literally 10 years ago, and the testimonials we've been doing now for 15 years, so you can find them 15 years ago. So let's put our link to the app. If you have a phone and you want to download the Deuk Spine Institute app, it's free. Just go to your app store and type in Deuk Spine Institute. You'll find our spine app. It's got a lot of great question and answer section. It also allows you to watch surgeries live. There's a live surgery button in there. And you can schedule an MRI review, a free MRI review in our app as well. All right, just about done. Look at all the damage here to this disc though. It's just massive. That pink thing over there to the right, that's the bone. And there's a little bit of inflammatory tissue there. But this is all part of the tear in the disc. It's clearly been here for a long time.
We have another question from Sue on Facebook.
Sure, Sue. Fire away.
She asks, what is the difference between the laser and plasma rhizotomy?
Ah, good question. Great question. So there's two types of additional rhizotomies that we perform at Deuk Spine. One is an endoscopic laser, the other one is plasma. So we do the regular radiofrequency ablation that everybody else does. We do it very well. But that probe that is used delivers, let's just say on an energy level, it delivers basically an energy level of 2, let's just say 2 or 3. That's not enough energy usually to kill the pain nerves long term. So the pain nerves come back. They recover from the procedure. So at Deuk Spine Institute, we developed 2 newer technologies that are more advanced. One of them is endoscopic laser rhizotomy. That's where we go in and put a scope in just like we're doing now, but instead of putting it inside the disc tear and the herniation, we actually go to the facet joint, to a specific location on the facet joint where the pain nerve is. And we use the endoscope to find the pain nerve, and then we use a laser to blast it and destroy it. Now that's going to give you an energy of about a 5 or a 6. So it's a lot more powerful than the radiofrequency ablation that's available commonly. And then if you do plasma, plasma is done without the endoscope. It's done just using X-ray guidance, and we deliver a very large amount of energy through the plasma probe. And that gives an energy level of about a 9 or a 10. Okay? So they're just, the endoscopic rhizotomy allows visualization of the nerve usually and targeting of the nerve with less energy than the plasma, but more energy than the RFA. And then the plasma rhizotomy is done without the endoscope. It's done not blindly, because blindly is not correct. It's done with the X-ray guidance, X-ray navigation. But you don't actually see the nerve. You're just kind of delivering energy where the nerve should be. So, but the plasma rhizotomy also causes more pain and discomfort afterwards. So the pain lasts about a week, and then it goes away. It's just going to end up doing a little more damage to the surrounding soft tissues and muscles, because you're delivering energy, more energy to that area where the nerve is, which there's muscles right there as well. So they're just 2 different possibilities. They're 2 different options. Besides the RFA. And of course, if none of that works, the last resort is fusion. But fortunately, we've not had to. We used to fuse lots of people when they had facet pain, and the RFA didn't work. You know, we tried it, it made them better, but it wore off quickly, and then we would schedule them for a fusion. Now we don't have to do the fusion. Hey, Luis, look, should he be on the side here, or should he be more like here,
Yeah,
pushing here?
Be like that, yes.
Come on.
Yeah, yeah. Not here, just
All right. No, here. Okay, think about it. What if you do this? Where's the tip going to go?
straight in.
It's going to go towards you. If you do this, where's the tip going to go?
This way.
Yeah, it's going to shift to a different position. I want the tip going there. Come on. There's more inflammatory tissue right there. You see how pink it is? Now this is right outside the disc. We are literally right outside the disc and still in the disc right here. And this is all part of the annular tear. But over here, right in this area, we're outside the disc. So I know I'm at the end of the disc here. We've cleaned it out from inside out. The red stuff is blood, obviously. And there's still some herniation right there I've got to get rid of. Anybody watching Stranger Days on Netflix? Are you kidding me? Stranger Things. Sorry,
Stranger
Things. I
Things.
apologize. I said Stranger Days. My daughter laughs at me when I
I was
mess
just
it
about to
up.
ask.
I'm like, how is that possible? Nobody's watched it. Stranger Things. Who watches Stranger Things? Yeah, so a lot of people do, right? They say it's about to become the #1 watched show on Netflix. Yeah.
It's pretty popular.
Well, yeah.
I love the Lincoln one. I thought that was amazing.
Lincoln Lawyer. Yeah, you told me about that. I saw the movie. I haven't seen the TV show. I like the movie. Oh no, I'm not getting where I need to be, Luis. I don't know. What can you do different? That's better. What did you do?
You just move a little to the right.
That's a herniation right there. Standby laser.
Stay close to the
All right. Any other questions?
No current questions.
All right. Let's go ahead and show our audience what would happen if the Deuk laser disc repair wasn't available. What would we have to do to get rid of this back pain and pinched nerves in this patient? You're grabbing a little too hard.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod called a dilator is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Yeah, that's really good. Don't touch anything here. Oh, came out a little bit. Shot? Yeah, all right. Okay, welcome back. We're getting ready to do the L5-S1 level, and that was the one that I could not actually get into the disc, but I'm close to it, and we're going to attempt a technique where I get down right behind the disc and then we go in. I need the patient completely asleep. Is he good? Shot? All right, so you can see the guide wires right there at the back of the disc, a little inferior. And the reason for that is the facet joints have forced my needle south. Hey, just lay still. Shot? And by forcing the needle tip south towards the feet, I have approached the disc at the bottom of the disc. Shot? So I'm at the bottom of the disc, and what I'm going to do is, once I get there, shot, I'm going to adjust the direction of the dilator to go into the disc. So it's a lot easier to do than trying to get the needle into the disc when it's tough. Shot? Just about there. Yep. And I saw on the other view the AP was in perfect position, so I'm very happy with the position of the tip of the needle and the dilator at this point. So let me know when you're ready, because I need him comfortable. I could try to give a little local down there. What do you think? Huh? What do you think? You think the 1/4% will affect the nerve at all? The nerve root? Huh?
Yeah, I think it'd be okay.
The nerve root? I mean, but
Maybe just give a half a cc.
is there any, it's bupivacaine? Why don't we, I wouldn't mind trying just some lidocaine. I just don't want that long term. He seems to be okay right now, right?
I'm just going a little cautious.
Yeah, I understand. Don't give him too much. I'm gonna see if I can advance this. So I've got it right. No, I've got it right where I want it. Shot. Pay attention. You see how I'm outside the disc?
Yes, sir.
I'm gonna tap this directly. Shot. Well, it's working. All right. So we're in, and we're ready to go. Yeah, he did good. I think we have pretty good control. I just don't want that. I don't think I want the bupivacaine.
I think lidocaine's better.
Just lidocaine, right? Maybe the 25.25.
Yeah, perfect.
Luis,
Okay. So
at some point, maybe not right now, but in the future, I don't mind having some of that available.
No problem, sir. Yes, sir.
All right.
and it is beneficial for you to give a little less medicine to see.
Of course, I know that, if we can do it.
Yeah.
The question is, will it numb the root, which we don't want? And that I don't know. But I guess we could try it. It's good to try on a longer case, because if it does have an effect, it'll wear off.
It should be gone by the time arrival.
That's what I'm hoping.
I agree.
Yeah. All right, any questions?
Yes, we have a question from Gail on Facebook.
Hi, Gail.
And she asks, Doc, if a person has scoliosis and degenerative disc disease, annual tears, and being 75 years old, can these procedures still be done? My pain is lower back, feels more like intense pressure rather than nerve pain, but it's debilitating. Is there any hope?
Hi, Gail. Dr. Deuk Machen. Don't take it all out, just a little bit. Yeah, give me one sec, Gail. I'm just working on something here. I'm going to answer your question. The short answer is absolutely this surgery will work for you. No doubt about it. Every single patient we do this surgery on has degenerative disc disease. Every single one. It's just different amounts of degenerative disc disease. Some have more than others. Shot? Yeah, nice. Oh, but the tube is coming out? All right, let's leave. Let's see. You know what? I mean, I think that's progress. So Gail, the scoliosis is not the problem. You have a degenerative scoliosis, and that degenerative scoliosis is not causing your back pain. For years and years, I thought it was the cause of back pain. You can go further. There you go. But it's not the cause of back pain. The degenerative scoliosis has nothing to do with the back pain, believe it or not. You're slipping off. You're slipping. So go back down and re-grab. Do it again. Yeah, I'm good. Yeah, you're very good. Very good. Let's see where we are. Shot? Oh yeah, that's good. So, Gail, the degenerative scoliosis does not need to be fixed at all. It is not the cause of your back pain. I did surgery for degenerative scoliosis for 25 years, doing screws and rods and osteotomies and cages and correction of deformity. I was a very, very big, one of the biggest deformity surgeons in terms of sheer volume of patients for years and years. And sure, the fusion will work to get rid of the back pain, but not because you're fixing the scoliosis. It's because you're fusing the disc. So the pain is coming from the disc. Even if you have degenerative disc disease, scoliosis, listhesis, spondylosis, all of those conditions, the pain is coming from exactly the same place in every one of them. And it is the tear in the back of the disc. That's what we're repairing with the surgery. So every one of my patients has some degree of degenerative disc disease, scoliosis as well. Sometimes it's not much, sometimes it's a lot. And even though they have horrible scoliosis, the worst cases I've seen, their pain goes away with the surgery because we're fixing the source of the pain. That's the whole point. That's why we do these broadcasts. There's so much wrong information out there about what's the cause of the pain. And the real cause of the pain, like I said before, 80% of the time is the disc. And it's a little tear in the back of the disc. And that's what we're fixing right there. You see that right there? Gail, right there, that pinkish, weird area, that is the cause of this patient's back pain. And if I blast it away with the laser, the back pain goes away. Right there. Okay? So that's all you need. You don't need major surgery. There's totally hope. We'll cure your pain. Come to Deuk Spine Institute. But just anybody like Gail out there, right here is the source of pain. I'm destroying it. This is the annular debridement of the Deuk laser disc repair. We created it. I created it 16 years ago, 2006, this procedure. And I've been doing it ever since. And it really, really works. It takes the disc pain away. And I've done now 1,500 patients, surgeries. I've done an average of 2.4 discs per surgery. Do the math. What is that? That's about 4,000 discs. And I've never not gotten rid of the pain in 4,000 discs. Now, some people have other causes of pain besides their disc, like the facet joints or the piriformis muscle or their SI joints. And those require a different kind of treatment. But You can easily figure out that out by doing an exam and some blocks. So, long story short, you need to go to a place that can cure your pain. We can do that here at Deuk Spine. Send us your MRI. We'll do a free review and let you know what needs to be done. And will you make sure the mri.deukspine.com address is posted, please?
Already did it.
All right. Great question, Gail. We get that a lot. You don't need any major surgery to get rid of your pain. And you certainly don't have to live with back pain. It is totally fixable. All right, are you teaching your nurse? Who's here with you? Sarah? Hi, Sarah. Yeah, let her do hands-on. That's the best way to learn. Sure. Yes. No, you're right. So Sarah, one of our nurses, asked a great question. She said, when you see calcification like that gold stuff right there, that's calcification. Is it based on the length of time, or are there other factors? And the answer is it's based on the length of time. So the longer the inflammation and scarring is going on, the more calcium deposited into that tissue. It's a process called dystrophic calcification. It's a pathological process. Your body will calcify tissues that are damaged. It doesn't have to just be the disc. It could be any tissue in your body. That's why, like cancer, breast cancer has calcium spicules, right? Because it's abnormal tissue and it gets calcified through a process of dystrophic calcification. So any kind of damage to your tissues in time will become calcified. Does that answer your question? But it has nothing to do with how much calcium's in your diet, you know. Maybe it'll be affected by thyroid levels. Thyroid hormone levels that control calcification. All right, just about done. The reason this disc is not blue, we did not do the dye stain because I didn't have the needle inside the disc. I couldn't get it in. It was being deflected by the facet joint, which was enlarged. But I was able to get the dilator in later. It's a technique developed at Deuk Spine Institute by me, Luis, our team. And by the way, for those of you with L5-S1 disc problems, 99% of endoscopic spine surgeons won't treat L5-S1 the way we do, transforaminal, because they have a hard time getting in there. So it's very difficult to do what I do. I make it look easy, but the reality is that the vast majority of endoscopic spine surgeons that do transforaminal surgery, they won't even try it because it's so hard to get into L5-S1. All right. So there's your annular tear. We're debriding it right now, and we're almost done. After this, we've got one more disc to do, L2-3. Any more questions?
No current questions.
All right, so for the latecomers, let's show everyone why do herniated discs cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. We're just finishing up the L5-S1 disc herniation. There's a little bit of fat right there, but we're not here for the fat. But sometimes it wiggles loose and gets into the operative field. This is all herniated disc I'm removing, and it's so scarred up. I apologize for the poor visibility, but that's the debris coming out. And I'm basically releasing the herniation right there. So I'm going to see if I can grab it out. There it is. Yeah, come on now. I think I got a lot of it, but not all of it. I felt it tear. So where can you go to get this kind of surgery? Well, you got to come to Deuk Spine Institute. There's no one else in the world that does what we do. We're near Orlando, Florida, on the Space Coast. And all of our patients that come from out of state, they usually fly into Orlando, and they'll spend 3 days at our facility and get fixed. Any questions?
No current questions.
All right. Great. Well, we like to have audience participation. If we don't get it, then we start talking about other stuff. Sometimes. Inappropriate things. Huh? Like medieval torture, that's right. What are we going to talk about today?
Come on.
Huh?
You come up with something, Crystal. Come on. Bring a subject.
Favorite places to travel. I like that. That's safe. All right. Huh?
Bucket list.
Bucket list places to travel. All right, let's go around the room. Who's going to go first? Since you brought it up, you go first. Yep, you start. She said Japan. You know Skoshi? Skoshi. Skoshi means a little bit in Japan, Japanese. Skoshi.
Squishy. Arigato.
All right, so you want to go to Japan because you admire the culture, and you've never been, obviously, you want to go. Where in Japan would you go?
Villages?
Where? Nice.
Sounds like Crystal's been there.
I think she has.
I think so. She's saying every city. I'm impressed.
Crystal, were you in Japan before? Yes. What were you there for? Nice. So your sister was there teaching language? Uh-huh.
Imagine.
When did you go? Oh. I was there in 85. Sorry, 86. Yeah, you don't have to go to Japan to see the cherry blossoms. It's dirty. Yeah, let's see. I can't get it out. There's something in there. Where?
You need to open now, clean. On this side, for the side.
It's a little tight. See if you can clean it better. All right. You want to climb Mount Everest? Oh. All right. You want to go to Everest Base Camp? Nice. All right, it looks good. I think we're done here. I wonder if we can see the nerve. I think we may be able to because it's so collapsed here. We're going to try to see the nerve. So there's the end of the disc. The nerve is right there. There it is. There's the nerve, guys. See the red lines? Those are veins on top of the nerve. But that white thing is the nerve. And see how close we are to it. Let me just clean that fuzzy stuff up a little bit more. That's the annulus. It's frayed. Yeah. That looks good. Very good. Now you can see the annulus will mend itself. It'll seal off because it's now the herniation is out of it. All right. So we've talked to Crystal and Sarah, right? Who else wants to share their bucket list location they want to go visit?
I want to go Fiji.
Fiji. You want to go? Luis wants to go to Fiji. I need the dilator. That's in Fiji? The International Day timeline? I didn't know that. Is that why you want to go, Luis? Oh yeah, the water and the beaches. You said the beaches. I thought you just want to make sure you didn't say something else. All right. That's clogged a little, by the way. Here you go. We are done with L5-S1. We've got one more disc to go. That's going to be the L2-3. So far, everything is going perfect. How's our patient? Hello? How's our patient doing?
Hey Chris,
Good.
we have more rates next week.
Let's watch your shoulder. Just bringing the floor in. Think about the steps so you know how to anticipate what's going to happen next, okay? You got to start thinking. You're going to be wrong about what's next, but then you'll learn. You know what I'm saying?
Yes, sir.
Then the next time you'll learn from your mistake. All right, so we got Luis who wants to go to Fiji for obvious reasons. Beautiful beaches, clean water, maybe coral reefs. I don't know. Jordan? Alaska. Oh, wow. You know, funny you say that because my wife wanted to do Alaska for years and she kept bugging me and I'm like, hell no, I'm not going to Alaska. I just kept thinking of like ice, cold, you know, nothing to do, boring. That's what we did. We did a cruise and it was amazing. It was one of my favorite trips. It's so weird, you know. We got to see the salmon, we got to see bears, we took a train ride through the Yukon and learned the history of the gold rush and the area. It was really interesting. I like trips where you learn stuff, but it's still fun. We went on a helicopter ride. All 50 states. Really? So you've been to almost all the 50 states?
You want to pay for us?
Where did that come from?
She's been everywhere.
Right?
So
Let me have the dilator. All right, so you want your bucket list is to visit all 50 states. That's pretty good. I think I've been to like 15 maybe at most. All right, so Jordan said Alaska. And you were going to tell us why. Why do you want to go to Alaska, Jordan?
I think just the nature.
Nature. That's good.
Calming, relaxing, away from people.
It is.
Very calming.
It is actually all those things and more. Lay still. Do we have just the 25%? No? We'll just do it next case. Yeah. All right. So we are awfully close to where we need to be here. Oh, no, that's this. This is this. Okay? Don't put them both in my right hand. If I have two empty hands. Shot. All right. Shot. Wait. Let me just see. It feels good, yeah. Very good. We're in. And there's a big tear there. It went in so easy. So the easier it is for this dilator to go through the tear, the bigger the tear is. Who, me? Who? Oscar.
Oh, me? Switzerland.
Switzerland. Wow. Swiss Alps or just Switzerland towns? What are you,
All over.
the banks?
Mountains.
The mountains, yes. The Swiss Alps.
Yeah.
Skiing or what?
A little bit of everything. Actually, I like snowboarding. So.
Nice. Mm-hmm. Switzerland? No. I have never been to Switzerland. I almost went. I would love to go. It's right there. The problem is I love work too much. And my wife is not happy with me about that. I just like doing what I do. I don't know. It's hard for me to take time away. You know, I could have retired years ago. Retired well, lived well. But the truth is I just love doing this, fixing people. And that gives me more joy than traveling and spending money on expensive things. Ah. So you've never been to the Greek Isles? Me either.
And we had some friends that went there for their 20th anniversary. They came back with all these really cool videos and photos, and we watched them all.
Really?
Yeah, and they said they would go with us for our anniversary. So
Then go.
yeah, we might go one of these
See?
years.
There's still opportunity to go.
It'd be nice to go with someone who's been there like twice already. They've been there twice. So they can kind of show us around a little bit.
Well, I've got a guy I could send you with. He's Greek. He's actually ICU attending. But I think you would, I don't know how you'd feel about it. He's very talkative. He may talk your ear off. But he's Greek and he would love to go with you, so let me know. He's a doctor. Greek Isles. So which isle in particular?
Well, I like to go to see Mykonos. I like to see
I was about to say that one.
Mykonos. I've heard that so many times. Why is Mykonos so famous? What is on
It's
Mykonos?
like the villages, it's like right by the ocean. It's like perfect views, the pool, everything.
No, that's Santorini. That's Santorini. By the way, you can see the tear right there in the annulus. Yeah, ever since they did that Tomb Raider movie in the Greek Isles, remember that one? I forgot the name of it. With Angelina Jolie. and you just see the Greek Isles. They're so beautiful. Actually, I think the first time I ever saw the Greek Isles was in a James Bond movie.
Oh yeah, they've been there.
Yeah, that was that was one of the nice things about James Bond movies back then, is that there were no like travel videos, there was no internet, it was just the movies. And James Bond always traveled around the world, so you got to see all these exotic places.
I think it's the most beautiful color water I've ever seen.
The Greek Isles? Yeah.
It's like that.
I don't know.
Bright blue.
I mean, I've only seen it on photos, but it's pretty cool.
Yeah, but the Caribbean has some really beautiful water too. Turquoise, you know, like beaches. I mean, what is it called? Turks and Caicos?
And the Keys, I know, like, it turns really, like.
I don't know. I don't know how pretty the Key water is, but I think it's definitely nicer than what we got here.
Yeah.
That's for sure. My place that I want to go? Well, it used to be space. Yeah. But now I've seen so much pictures of space, it's like, yeah, I don't know that I want to go there. Let me think for a moment. Okay, so for me, it's probably the Maldives because of diving. I love underwater stuff like fish, coral. That would be really, really cool. The Maldives. I've never been to the Great Barrier Reef. Never been to Australia. There's a lot of places I've never been. All my traveling is right now is for my kids, for his racing. So I don't get to go see neat stuff. But it's not, you don't understand. Literally, I wake up in the morning and go to a racetrack, and you sit at the racetrack all day, smelling exhaust, sitting on a hot black tarmac, basically. There's nothing to do, and you're just waiting for your driver to go out. At least with go-karting, he had a lot of races, so it was like every 30 minutes I was watching a race. But with racing cars, it's 2 races a day, and so you're sitting there for 4 hours twiddling your thumbs. I ended up buying a bicycle, so now I go for bike rides in between his races. Yeah, try to stay in shape, use my time wisely. All right, who hasn't told us yet? Oh, we got everybody? We don't have Henry.
No, you didn't.
Henry, your bucket list place to go. Where do you want to go visit?
Oh, where do I begin?
Let me guess.
Okay.
Let me guess. Let's all try to guess Henry's place, okay?
Yeah.
You say, Dr. Burndes says Hawaii. I say Ireland.
I'll say Spain.
Spain, from Oscar. Luis?
I have family there.
Luis, what do you think? China. All right. Luis said China. Who else do we have? Crystal? Where does... Huh? Iceland. Who said Iceland? Sarah or Crystal? Sarah thinks you want to go to Iceland. One more guess. Have you ever met Henry? Philippines. All right, so Henry, everyone's waiting with bated breath.
You, Dr. Deuk, got it on point. Ireland it was the one.
Ireland, wow.
Like,
well, I do spend the most time with you of all the people here.
I'm like
Huh?
I'm mind blown at how you got that right. I'm like, whoa.
Ireland is one of those places. It's beautiful, and I don't know, maybe you're Irish, I don't know.
I'm Jewish, but I've been dying to go.
You could be a Irish Jewish person.
That is true.
Yeah.
That is true.
Yeah.
But no Irish in me. I'm just dying to go.
Awesome, awesome. Well, good guess. All right, we are just about done. We've got about 5 minutes left maximum, and this is our last disc that we're fixing. This is the L2-3. So if you have questions, feel free to ask them. We're just about finished, and I'll be happy to take your questions live in person in the broadcast room in our production room, and I'll be there in just about 10 minutes from now. So if you're watching this stream today on the 9th of June 2022, you're watching it live most likely, and we're just about finished. Once again, Deuk Spine Institute is located in Florida, on the Space Coast of Florida, and we're going to be done here probably in 5 minutes to 10 minutes, somewhere in there. See how the next few minutes go. Again, you see calcification there, big tear. The laser fiber is just debriding the annular tear. That's the key to the surgery, getting rid of the back pain and removing the herniation safely. People talk about lasers in medicine and surgery as being, I see all kinds of stuff, but it's all absolutely lies. Don't believe any of the negative stuff you read about lasers and spine surgery. The problem is, to use a laser, you have to see what it's doing. And that means you have to do endoscopic surgery. There's no other way to see what the laser is doing. The problem is that 99.99% of spine surgeons are not endoscopic surgeons, so they don't see the laser like we do right now. But you can see how easy it cleans tissue out. There's no way to do this with metal. And so this is the best tool in the world for endoscopic surgery, okay? But a lot of doctors will tell you lasers are unnecessary, they're dangerous, they're actually full of you know what. And the reason why they say those things is because they don't, yeah, I know, thanks. The reason why they say those things, bad things about lasers, is because they don't know how to use them. And they're losing business to the laser surgeons like me. People don't want traditional back surgery with screws and rods. What do you want to do? I've just got a couple more minutes. You want to give him another bolus or what? Huh? Can you come over here, Crystal, and help at the head? So there's just a lot of misinformation out there. That's kind of like, let's say you want to buy an electronic vehicle, an EV, right? And of course, what do you think the people that sell gas vehicles are going to tell you? They're going to tell you all the bad things about electronic vehicles. But the truth is that electronic vehicle is definitely going to cut down on emissions, right? Greenhouse emissions, right? So it's the same thing. It's like the surgeons that don't do laser are the ones criticizing it. You never see a surgeon who does endoscopic laser surgery criticizing endoscopic laser surgery. It's kind of upsetting because it's very deceptive. Man, this is a bigger herniation than I thought based on the MRI images I saw earlier. You can never tell how big a herniation will actually be until you get into it and see it. Oh, just need a couple more minutes, guys, and we'll be done. Grab her. Nice pass off there.
Yes, sir. Thank you.
How's he doing? Good? Just tell me what you need me to do. Am I okay to keep going? I think we've got most everything we need. Here, let me have that. Yeah. I'm okay with the moving. I just would like to try to get this last little bit right here. Do you need me to flip them over? You can wake him up a bit, Dr. Berners. I'll help you. Get ready to bring the gurney in. Just a minute.
Make sure the bed is made and ready and have it right here.
Grab her. All right, we're just wrapping this surgery up. Everything okay? Just done right there. Would like to zap a little bit more. All right, looks good. That's up to Berndes. Scope off. Take. Take. Are you okay where you are? You need to flip them over. I want you to forget about all that. Get some steri strips on, just in case.
You're ready.
Yeah, do the lower one.
You want to do suture or not?
I would like to. All right, any questions from the audience?
No current questions.
Great. All right, let's go ahead and show them a patient who had the Deuk laser disc repair recently. You got the rest?
I got it.
Small incisions. It's Dr. Deuk at the Deuk Spine Institute here in Florida with one of my patients who had the Deuk laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well, thank
and I
you.
came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
Amen.
yeah, and I'm A1 now.
Awesome. So you had your surgery, you've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too, when you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
Not too soon with any of that lifting engines.
all right,
and
all right,
contorting your body.
yeah, all right. But I have, all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got, well, that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back, But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well, congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
You're
God
welcome,
bless.
sir. God bless you. I'm Dr. R. Deuk Machen here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration, where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Deuk laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I mean, I know I'm on camera right here, but I literally could not walk into the office yesterday. And I mean, you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
And I'm just, it wasn't even close. I was actually, and I don't know if you can tell from the camera that what my personality is, but I try to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means. It's because I hurt so bad. I'd never experienced pain like that. And like I said, there's no
Because you're a redneck too. You know, you're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right. Yeah.
A couple of states. So you're feeling better today. It's been less than 24 hours since we did your surgery. You went home an hour after the surgery, back to your hotel with your lovely family who I met. And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. You know, now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir. Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have prettied you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, right. Going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I am just going to rest and watch TV, but then we're going to get on a plane a little bit.
Awesome. Yeah. All right. Well, congratulations. You had faith.
Yes.
You took the leap and you got the surgery done.
Yes, sir.
All right. Awesome.
Yep.
Hi, I'm Dr. Ara Deuk, and we have just completed 4 disc repairs on one patient through 2 little 7mm incisions. Each incision was a 1/4 inch, and there was no metal done, no fusion. And this patient had problems with the disc at L2-3, 3-4, 4-5, 5-1. Just to give you an idea of what I'm talking about, this is a model of the spine, and this patient's back pain and leg symptoms of weakness were coming from these discs here, 1, 2, 3, 4. So we repaired all 4 discs, and it took us about an hour to do it. In the old days, if we wanted to do the same kind of surgery of getting rid of back pain and leg weakness, numbness from pinched nerves, we would have to make a big incision, remove all the bone and ligaments, getting the pressure off the nerves. It might look something like that, and then put screws and rods in on both sides. The patient didn't want that. He wanted the less invasive surgery. So that's what we did. Everything went really well. No problems with the surgery. We fixed all 4 discs, and we answered a lot of good questions. Any questions from the audience?
Nothing so far.
Yeah, so I would just say, if you've not downloaded the Deuk Spine Institute app and you're interested in learning more about back and neck pain and treatments for it, download the Deuk Spine Institute app. It's free on both the Apple and the Android platform. Also, we have a free MRI review available online and through the app at mri.deukspine.com. And I just want to say one last thing, since we don't have any questions. We're going to wrap up the broadcast, but we had one of our patients, I mentioned it earlier. She came in yesterday and brought us brownies. All right, hint, hint. But the brownies are amazing. Just look at this thing. These are made at home. You've got that nice, really moist center with a little bit of a crunchiness on the outside, and you've got nuts and chocolate syrup. So if you're watching, I can't mention your name, but thank you. Everyone here loves them. I think this is one of the last pieces left. And I'm going to go eat one and get fat. So we'll be seeing you shortly for the next surgery. It's going to be a thoracic Deuk laser disc repair at 2 levels. This patient injured his spine at work, and he has a T2-3 herniation and a T5-6 herniation. So that'll be next. Hopefully you can join us later.